Pediatric surgery can take a kid who's at the sickest point in their life, and you have the opportunity to completely cure them of that problem. I'm Sara Mansfield. I'm one of the pediatric general surgeons here at Nationwide Children's Hospital, but one of my areas of expertise is chest wall disorders. Chest wall disorders, basically anything that has grown differently with either the bones or the muscles that make up the chest. So that's usually the ribs or the sternum are the most commonly affected. These can range from fairly mild with no symptoms to severe defects where the chest can really cave in and push on the heart or lungs and cause symptoms with breathing or how the heart works. When they get to puberty is when we see the chest wall really start to grow, and it can get worse if there's some underlying deformity either in or out when they go through puberty, and it becomes much more noticeable and potentially even cause symptoms at that time. So different things we can do. We have braces that can help with some of these, specifically the ones where the chest is sticking out. That's a pretty easy fix with just pushing on it with a brace. The most common surgery that we do is called a NUS procedure, and that's specifically for pectus excavatum, where the chest is sunk in. And that procedure basically uses a metal bar put across the chest, and that pushes the sternum out. We do this minimally invasively, meaning we have little tiny incisions to put a camera into the chest and pass the bar under the sternum. We've taken a procedure that used to be an inpatient stay of a week or more and months of pain to most patients go home the next day and really get back to school and things much quicker than they used to. One of the slogans in pediatric surgery is saving lifetimes, and I think that's what we do most days. Seeing kids after surgery and you realize the impact that you've made on them, that's what keeps me going most days.